Hello everyone, this is SLS Ram from BED 3A. For today's video, we will talk about metabolic disease. So, what is metabolic disease? Metabolic disease is according to my research, is any of diseases or disorders that disrupt normal metabolisms, that process of converting food to energy on a cellular level. And metabolic disease affect the ability of the cell to perform critical biochemical reactions that involve the processing or transport of proteins such as amino acids, carbohydrates such as sugars and starches, or lipids such as fatty acids. Metabolic disease are typically hereditary, yet most persons affected by them may appear healthy for days, months, or even years. So, the onset symptoms of this disease usually occurs when the body's metabolism comes under stress. For example, after prolonged fasting or during a febrile illness. So, how we can prevent this metabolic syndrome or disease? We can prevent it through a lifelong commitment to a healthy lifestyle may prevent the conditions that cause metabolic syndrome or disease. A healthy lifestyle includes getting at least 30 minutes of physical activity most days. Eating plenty of vegetables, fruits, lean protein, and whole grains. Limiting saturated fat and salt in your diet. And now let's go some of the most common types of metabolic disorders, such as diabetes. This is the most common metabolic diseases. There are two types of diabetes. Type 1 is the cause of which is unknown, although there can be a genetic factor. So, the type 2 is which can be acquired or potentially caused by genetic factor as well. Type 1 diabetes, the T cells attack and kill beta cells in the pancreas, the cells that produce insulin. Over time, a lack of insulin can cause nerve and kidney damage, eyesight impairment, and increased risk of heart and vascular disease. And there are other common types of nutritional and metabolic disorders include Gaucher's disease, and it is the causes of it is inability to break down a particular kind of fat which accumulates in the liver, spleen, and bone marrow. Second is the glucose galactose or glucose galactose malabsorption. This defect in the transport of glucose and galactose across the stomach lining, which leads to severe diarrhea and dehydration. Third is the hereditary hemochromatosis. This disease is excess iron is deposited in several organs and can cause liver cirrhosis, liver cancer, and diabetes, heart disease. Fourth is the maple syrup urine disease or the MSUD. It can disrupt the metabolisms of certain amino acids. Fifth is a phenylketonuria or PKU. Correct me if I'm wrong my reading or the pronunciation of this disease, because I can't read it well. This disease causes PKU or the phenylketonuria. It can causes an ability to produce enzyme that result in organ damage, mental retardation, and unusual posture. So that's it. Thank you for watching.